all of these wonderful panelists who are from across Washington and Idaho for a really important conversation today as attacks on reproductive health care and access to health care escalate. It's a really important period for us to be shedding light on these stories and telling the truth about what is at stake right now in our country. We have a wonderful panel here, so I won't take too much time for an intro, but I just want to say thank you all so much for being here, and I will turn it over to the wonderful Senator Murray. Thank you.
All right, Kelly, thank you so much. Thank you. Thank you. Apologize for being late, traffic. Okay. But we are here, and good to see all of you. Yes, we have an amazing panel today, and thank you all for being here. Kelly, thank you for all your work in helping put this together. It is such an important time to let everybody know what is happening to healthcare, especially women's healthcare and especially reproductive rights healthcare in our country. I have been raising the alarm since the Supreme Court overturned Roe v. Wade, and things have not gotten better, as you will hear today. But it's so important for people to know the state of play now and what we are doing and what the impact is. So I'm really delighted to be here today with some patients who will share their stories as well as some providers. And again, it's so important for people to understand. So let's start with the state of play. Obviously, a few weeks ago, the president and Republicans passed what I call the big ugly bill, which is going to have a huge impact on women's health care. First of all, it defunds Planned Parenthood. It's now law. It's defunded. And that means that clinics around the country are going to be closing, which is really going to impact, obviously, women's access to reproductive health care and abortion, but also to women's health care in general, as those patients, when they lose access to that clinic, are going to have to go somewhere else, which will impact everybody else, because the more people trying to access health care at a clinic, the less chance you have to get in timely, and costs are going to go up for everybody. I'm really glad here in Washington State we are working to fill the gap, but many of these clinics that are going to close are in states where abortion is legal. So it is going to impact even in the states where it's legal. Secondly, this bill slashed Medicaid and healthcare funding for millions. 15 million people are going to lose their health care in our country. That means fewer places for people to get access, and again, costs are going to go up for everyone, but especially in rural communities, and especially for women, because often it's labor and delivery that is one of the first services that has been cut when people try to cut their costs back. And also in that bill, the Republicans did not extend the tax credits for healthcare premiums, which means people are going to lose healthcare and costs are going to go up for everyone. Everyone that loses their healthcare or can't afford it or goes off of it means when they need healthcare, they will still access our healthcare system, and they will be uncompensated care, which means everyone else's costs are going to go up, and people in this country are going to start seeing that impact this September and October when they get their insurance premiums for next year. So that is going to impact everybody, but it will again impact women in particular. Now, that's not all. Trump and Republicans are continuing to go after abortion care. Trump put on a near total abortion ban for veterans and service members at the DOD and at the VA. That's going to impact a million women who are serving or who have served our country. He ripped away the protections that ensure that women can get access to reproductive care in emergency rooms, the EMTALA decision. And of course, we know that they're packing our courts with radical anti-abortion extremists. So day after day, we are seeing the impacts, and those are already done. We also know that Republicans are trying to rip away access to medication abortion, which most women use in this country, and that will impact women even here in Washington State where abortion is legal. They're trying to advance dangerous fetal personhood legislation, which will make it impossible for women nationwide, even where states are where abortion is legal, to be able to get access. And they're still trying to when you put all of this together, I go back to the election when Trump said, oh no, we're not going to do this, it's up to the states. But you put all these pieces of this puzzle together, and it is moving to a national abortion ban for women across the country. So we're here to raise the alarm and let people know what's going on, but also to let people know we are pushing back. I am Vice Chair of the Appropriations Committee. Last week in our healthcare bill, our labor and healthcare appropriations bill, we put in back in the money for Title X and for teen pregnancy prevention programs, so that we have made some steps, but that bill is going to take a while for us to enact in law, but we're working on it. Sorry. We also have introduced legislation to restore the Planned Parenthood funds and to eliminate the changes that they made in the healthcare bill, or the big ugly bill that they just passed. But those are all going to take a long time, and it's going to take public support, which is why we are here today, to let people know what is happening and to join us in this ongoing battle. Again, I'm really excited that we have so many people here today that can really share their stories personally with all of you, so you can understand the impacts. And we're going to start with Kayla Smith, who I've known for a while, is an amazing person who's got the courage to share what happened to her, and it's important for all of you to know. So I'll start with you, Kayla.
Thank you. So as some of you may know, I shared my story in a multitude of ways, but in the fall of 2022, my husband and I found out we were pregnant again with our second child. And this was just after Roe was overturned. And so obviously there was fear with that, but the only thing that we were concerned about was preeclampsia, because that's what I had dealt with before in my prior pregnancy. And then the day after the trigger law went into effect to ban abortion in the state of Idaho, we found out that our son had several fatal fetal anomalies. And so our maternal fetal medicine specialist shared with us that unfortunately, if we wanted to end this very wanted pregnancy, that she would no longer be able to help us in the state of Idaho. So we found ourselves kind of in this place where we didn't know what we were going to do, because the risk of me staying pregnant could impact my life if I were to develop preeclampsia again, which was very likely. So we had to take out a $16,000 personal loan to drive 8 hours from Idaho here, actually to the University of Washington, where I received an induction, and we were able to meet our son. And it was the most tragic thing we ever had to deal with, to make that decision, but then to also be forced to flee our state, to have to go somewhere else to get care that we should have gotten, was just devastating. Also the financial impact of that as well. And in that moment, like, I did not want an abortion, but I needed one, and I felt like my providers were not able to give me that standard of care that should be available to everyone. So now, at this point, my family has moved to Washington. I have had another baby that we welcomed in 2023, and she's doing really well. We love it here. I did end up getting preeclampsia with her, so I was very thankful to be in a state where I knew that if my life was at risk, that not only would I be taken care of, but they would also try to take care of my baby as well. These abortion bans are not saving lives. They're actually putting more lives at risk, right? We know that cutting Medicaid is going to increase this. So over half of women who seek abortion care live under the poverty line. Getting an abortion now is a privilege, which it should not be, because it is health care that should be readily available to everyone who needs or chooses. Choosing to grow your family is a really nuanced thing, but so is abortion care. And so I'm thankful for physicians like Dr. Ereme, who are willing to talk about how Trump's cuts and the funding to abortion bans are impacting women and women's health care.
Thank you, Kayla. Dr. Ereme.
Thank you. So hi, I want to talk about how this legislation is an intentional and sweeping divestment from vulnerable and marginalized communities, all in order to provide tax cuts to the ultra-wealthy and large corporations that don't need it. I worry that this legislation not only will prove detrimental to abortion access and care, but also to reproductive health in general. So with the cuts to Medicaid, the ACA, and CHIP, we are looking at millions of people losing their health insurance. And this also blocks lawfully here immigrants from accessing Medicaid at all. So we are looking at a large portion of people who will no longer have access to basic medical insurance. And it doesn't stop there. There's going to be higher copays and higher premiums. So for those who think that because they are not on public insurance, they don't have to worry about this, that is not true, because private insurance will also be affected by this. And we will be in a situation, once again, as before Obamacare, where people are deciding between rent, food, and healthcare. And I can tell you which one is going to get cut in that scenario. This will also lead to massive cuts and lack of access to basic hospital care throughout the country and the state, particularly in rural areas, as the senator said. Also, it's expected that maybe about 140 labor and delivery units, mostly in rural areas, will be shut down because of this legislation. That means you are leaving people away from care, unable to access care, having to travel long distances to care, and basically threatening people's lives. Because when you have to travel long distances to care, that means if you are in trouble, you may not get care in time. In addition, it keeps going, Medicaid insurance covers nearly half of the births in this country, nearly half. By slashing that, you are slashing the ability for many people to seek pregnancy care. This also means seeking care in pregnancy for basic medical conditions that require treatment and monitoring during pregnancy. You are pushing people to only come to care when they absolutely need it, when they are critical, when they will need more care and more invasive care, and where people will die because they do not have the care that they require throughout their pregnancy to have healthy pregnancies. You're also denying people the access to have abortion care paid for by their insurance. If they don't have Medicaid insurance, they don't have the financial means to pay for abortion care, meaning you are forcing people to carry pregnancies that are not desired, simply because they do not have the financial wherewithal to pay for it. Meanwhile, billionaires get tax cuts. That is simply egregious and unacceptable that we are playing with people's lives to provide billionaires with more billions of dollars. And overall, we are already continuing to struggle with the maternal mortality rate that disproportionately affects Black and Indigenous people. This will only make that worse. It'll make it worse for Black and Indigenous people and for everyone in general. We are looking at a huge fallback from this that will affect pregnant people for time to come, and I really worry about the long-term effects that this will have, particularly our most vulnerable communities, our lesbian, gay, gender nonconforming, transgender communities, our Black, Latinx communities, and our immigrant communities. They will suffer the most, as they have always suffered the most. They will be disproportionately affected. And lastly, I want to touch on something that I don't think always gets connected to healthcare, or the drawbacks in healthcare this legislation will provide. The graduate student loan cap that blocks professional learners from seeking more than $200,000 to pay for professional school will cause a worsening of the already present physician and provider shortage. You're basically only allowing people who have the funds to shell out $400,000 to pay for their education, or forcing people to take on predatory loans that will have a negative impact on their careers and on their lives. And that lack of physicians will lead to longer wait times in the emergency rooms, longer wait times to see the doctor. When you want to see the doctor, appointments are already being booked out for months at a time because there are not enough providers to take care of people. And it will devastatingly affect the diversity of our medical workforce, which we know is not good for patients, it's not good for the medical system, and it's not good for hospital systems. So this legislation deprives people of their access to reproductive health care. It deprives people of their choice in wanting to start a family, not wanting to start a family, and being able to start a family in a safe and healthy way. And it blocks people from their basic human right to receive medical care. This legislation will lead to many preventable deaths, and it's just not acceptable. So now I want to turn it over to Emily Cuarenta a patient storyteller and student at Eastern Washington University.
Hi, my name is Emily Cuarenta. My pronouns are she, her, ea, and I am a graduate student at Eastern Washington University. I am studying for a master's in public health, and I am a disabled abortion storyteller, married to an Air Force service member, and back in 2018, I had my abortion in not Macon, Georgia. I had it in Atlanta, Georgia, but I was in college in Macon, Georgia. And I had previously interned for an Atlanta-based abortion fund with the executive director, Oriaku Joku. And she had told me that the South was already living in a post-Roe reality. And through that 10-week internship and through my own experience trying to access abortion care, I realized how real it was. I knew all the resources and information I needed to seek my own abortion, and even though I knew all the hurdles that I had to jump, I had to go through so much just to seek abortion care. I had to wait for the 24-hour mandatory waiting period after scheduling my appointment over the phone. I was required to receive medically inaccurate counseling that misinformed me about the risk of having an abortion. I had to mentally prepare to have an ultrasound performed on me the day of my appointment. And I knew that going to have a surgical abortion, I could not be alone. I had to have someone with me to escort me to the appointment. So I was lucky enough to have my partner, Nathan, there to accompany me and be my escort. And there was the additional part of transportation, going to find an abortion provider, a real abortion provider, because 95% of Georgia counties do not have an abortion provider. And Macon-Bibb County is one of those. So the closest abortion provider is in Atlanta, which is about an hour and a half to 2 hours drive. And Macon is riddled with fake clinics. They call themselves crisis pregnancy centers. I call them anti-abortion centers. And I was lucky enough to not fall or walk into one of those centers, but I know that there's several people that walk into those centers and are misinformed about their own pregnancy, and their health is put at risk because of that. And I had way too much on my plate. I was earning $7.25 an hour as a work-study employee, and that is still currently the minimum wage in Georgia. And the most I earned was $121 after 2 weeks of work. And I was lucky enough that my partner was able to be financially responsible before we met, that he had enough money to cover my abortion and our apartment moving costs, because we were moving in together that same month, because we were getting married that same month of my abortion. And it was just too much, but it didn't hurt. The clinic also provided a student discount. And I had all this information at my disposal, but somebody else does not. And this was before the overturning of Roe v. Wade. This was in 2018. And on top of that, I had insurance with the Affordable Care Act, and that insurance was not going to cover my abortion. That is thanks to things like the Hyde Amendment, and I wasn't married to my partner just yet, but even if we were married, TRICARE wasn't going to cover it. the Hyde Amendment prohibits that. And if we were in that same place now in Georgia, it would be extremely difficult, because how do we know that he would be provided that leave request to go to another state? And how would we know that we'd have the money to make that, I don't know, where would be the closest, probably Illinois would be their closest option. And how, like, there's so many factors to consider, and I feel like I'm all over the place, but I was so lucky and so privileged to have my abortion when I did. And even then, I know that there were so many people that were not in that same situation, and I feel for those folks. And I feel terrible that I feel terrible for having the privilege to have the knowledge and the experience that I had interning for ARC Southeast. Because I know that if I did not have any of that, I would have had to carry a pregnancy that I did not want to carry. I wanted to graduate college. I wanted to be the first in my family to graduate college. I knew that being the daughter of Mexican immigrants, that they sacrificed so much, and I didn't want that sacrifice to go in vain. And there was so much that I had going on health-wise that I had no idea. That I had a heart condition that was untreated, supraventricular tachycardia. And I was like, when I found out, I was like, I don't know what this means for my health. But now that we are married and we are bounced from station to station, we worry about our fellow friends in the military who are capable of getting pregnant, and what it means for them to request for leave to be able to seek abortion care. Because what if they're in Oklahoma or Tennessee or Texas or Florida, and I know that when I was sharing that I was going to have an abortion in Georgia, my husband had coworkers that are saying, like, I had my abortion at the clinic that your fiance is going to. And now my husband had a vasectomy because we're not having kids, and we're going to be stationed to a red state because we worry about my life and criminalization of the outcome of pregnancy. I felt like I was all over the place.
Thank you, Emily. Appreciate it. I think we're going to turn to Rebecca.
So thank you, Emily and Kayla and Heather, for being here today and showing the courage and the conviction to share your stories. And Senator Murray, thank you so much for your fearless, relentless fight during this critical time for reproductive health and freedom. So my name's Rebecca Gibron. I am the president and CEO of the largest geographic Planned Parenthood affiliate in the country, serving patients across 6 different states, from Hawaii and Alaska all the way to Indiana and Kentucky. Our affiliate also includes the states that we're talking about today, Washington and Idaho too. But I'm also someone who, at the age of 16, walked into a Planned Parenthood Health Center in search of answers and care that I couldn't find anywhere else. And now I have the incredible honor and privilege of leading an organization that exists today to make sure everyone, regardless of who they are, regardless of where they live, has access to that same compassionate, competent care that I received at the age of 16. Today, though, I want to speak very plainly. States like Washington are not just leaders in protecting reproductive health care, they are lifelines. As politicians across the country continue to escalate their attacks on sexual and reproductive health, criminalizing abortion, threatening providers, gutting Title X, and kicking Planned Parenthood out of Medicaid, patients are being forced to flee their home states. But illness doesn't stop at state borders, and neither should care. Idaho, where I live, is our starkest example. Since its near total abortion ban took effect, more than a third of the state's OBGYN providers have disappeared. In rural counties, pregnant women are now facing dangerous delays or traveling for hours just to be seen by a physician. As the Idaho Medical Association's CEO said, we're digging a physician workforce hole that will take decades to fill. This is why Washington's leadership matters, not just for Washingtonians, but for people outside of the state too. Investing in reproductive health care helps shore up the entire system. It ensures that providers like Planned Parenthood can keep their doors open to the most vulnerable, including those traveling from hostile home states. It lets people get timely, preventative care, and then they are less likely to show up in the ERs. Less strain on the system, better health outcomes overall. As Senator Murray mentioned, Planned Parenthood was targeted in the Republicans' federal legislative package because we proudly provide abortion care to patients who need it. And both we and this administration also knows that financially gutting Planned Parenthood would have ripple effects across the entire health system. Research shows that other safety net providers like federally qualified health centers can't fill the gaps if patients can't get care at Planned Parenthood. Health centers are already overburdened and under-resourced. In some communities, Planned Parenthood is the only provider for miles offering birth control, offering cancer screenings, gender-affirming care, STI testing and treatment. And this care makes a life-changing, huge impact for our patients. A year ago, one of our providers found a golf ball-sized tumor in a patient during a routine wellness exam. We helped the patient act quickly, and she's alive and well today because a Planned Parenthood health center was open in her community. We aren't backing down to this fight. I have been doing this work for 29 years in the Planned Parenthood health system, and we're going to do everything that we can to continue care. Our doors are open, and we'll do everything possible to remain a trusted and present provider in your community. But we also cannot take the state of Washington for granted. We serve this very critical and important role in this state, and that requires long-term investment to maintain a sustainable and healthy safety net of providers. And I have to say, I was very disheartened when the Washington State Legislature voted this year to implement a 55% cut to the Abortion Access Project, the largest cuts to abortion access in state history. We've made it clear to state leaders that for us to stand up to the Trump administration, Planned Parenthood needs to be fully funded and fully supported. And with this administration's attack on healthcare, state and local governments have to step up. We're very thankful that Governor Ferguson is committed to reversing the state's legislative cuts and is committed to covering the gap in lost federal Medicaid funding for Planned Parenthood in the state of Washington for the next year. But without additional investment, health centers will be forced to reduce services, close doors, or turn patients away. Patients are coming across state lines, but the sad truth is that patient care for residents of Washington is already in a deeply precarious situation. We need investment. We need support in order to keep our doors open. One patient told us about how coming in was, quote, one of the best experiences I've had going into any medical office. She felt like she was taken seriously, like she was seen as a person instead of just another body in a clinic. That's what we're fighting to preserve here. Dignity, trust, humanity. Washington can and should lead, because when you do, the rest of the country sees what is possible. Let Washington be the place where patients can find certainty, where they know without a doubt that care will continue for them. Because in this state, we understand something very fundamental. A person's health is worth more than any billionaire's tax break. Thank you. Now it's my pleasure to introduce Heather Mullin.
Thanks. My name is Heather Mullin, and I'm here because access to a safe and legal abortion through Planned Parenthood saved my life. And I grew up in Spokane. I came over to Seattle to go to college. Having an abortion allowed me to travel. It allowed me to move to New York City and sing on Broadway, sing in Carnegie Hall. It allowed me to move back to Seattle and meet my husband and choose when I had my family. I have 2 beautiful sons, and it allowed me to open my own wellness practice and have this really wonderful life that I am enjoying very much. My abortion story also includes childhood sexual abuse. Unfortunately, I was the victim of a predator who was a respected person in our community who used his position of power and access to harm children. And he once told me that he had noticed me when I was in the 6th grade, which makes me about 11 years old. But I was repeatedly sexually assaulted from the ages of 13 until I became pregnant when I was 15. And I knew that when I became pregnant at the time that I was not going to have the baby. In fact, I felt very afraid and alone, and I didn't want my abuser's baby to be my life sentence. So I sought out a legal and safe abortion at Planned Parenthood. I took the bus during spring break of my freshman year in high school when my parents thought I was at track practice. And I got an abortion, and nobody knew about it for a really long time. And I didn't really talk about it publicly until the Dobbs decision. And I really felt it was important for people to know that all sorts of reasons there are for having an abortion, that you probably know someone who's had an abortion. And when I started talking about my story, I realized that it was really a much more common experience than we sometimes think about and talk about. So in our current state, where we have outright abortion bans, including no exclusions for rape or incest, we're talking about forcing children to give birth. And that's the kind of thing that really keeps me up at night, and why I'm here today to talk about the importance of funding abortion care and access to abortion. It's disturbing to me that some of our government officials seem to be protecting predators instead of victims. We really rely on our government to have compassionate leadership, and we're talking not just about a healthcare crisis here. I think we're really moving into a human rights crisis. When people don't have the right of physical autonomy over their body, they really don't have freedom. So I think this is a larger discussion that we really can move into the human rights sector. But I'm here today because I was able to access a safe abortion through Planned Parenthood. And again, if I had not had that access, I really think at the time I would have subjected myself to a back alley dangerous procedure, or I would have taken my own life, because I really felt at the time that I didn't have any other options. So I'm very grateful to Planned Parenthood. I'm always going to be grateful. I want to keep your doors open for as long as possible. But thank you for your leadership and your compassion. And it's my privilege to announce Dr. Caitlin Gustafson.
Thank you. Good morning. I'm a family medicine obstetrician. I've been practicing in rural Idaho for about 2 decades now. I'm also president of the Idaho Coalition for Safe Healthcare Foundation. We represent over 1,500 Idaho healthcare professionals and concerned community members. Today, I've joined this conference and have the honor to do so with perspectives about how Idaho's near total abortion ban, one of the most restrictive in the nation, has harmed my patients, chilled my colleagues' ability to practice safe healthcare, forcing so many of them to leave our state, all of which has led to the unraveling of what was a safe system of reproductive healthcare and our healthcare system as a whole. I did residency training as a family physician in Idaho, and I've stayed all these years because it was a place I wanted to practice. It was a place that was safe to practice, and it was a safe system of healthcare that I was frankly proud to be a part of. One where I could take care of my small rural community to the best of my ability and the resources we have in small hospitals. But I could also refer my patients to a higher level of care when they needed it within the state of Idaho often. All of that changed with Dobbs. This triggered Idaho's extreme and dangerous near abortion ban into effect. And before the ban had even gone into effect in my state, I was still, to that day, helping patients through deeply personal, often complicated situations and decisions in the privacy of an ER bay or a clinic room. Since the ban, our ability to do our jobs that we were trained to do in time-sensitive and health-threatening emergencies even, such as bleeding or infection or organ failure, have put us in the crosshairs of criminalization. What do? Do we provide stabilizing care to our patients in their community, in their healthcare system, with the providers that they know and they trust, where our support and their support system is in place for them, or do we risk going to jail, losing our licenses, and facing financial penalties for doing so? What this has led to is a maternal health care crisis that was brewing long before. The longer Idahoans must travel out of the state to get the care that they need, not only do we face increasing maternal health complications, but worsening physician shortages. As Rebecca mentioned, we've had a crisis in that way as well. 15 months post-Dobbs, we had already lost 22% of our OBGYNs in the state of Idaho, fleeing the state from criminalization. This included more than half of the maternal fetal medicine specialists that I had previously referred my patients to with high-risk pregnancy conditions because they felt it untenable to continue practicing obstetrics in our state. We have been unable to recruit enough physicians to replace them because of the chilling effect of abortion bans. It got worse, though, after the initial exodus of 22%. A peer-reviewed study came out just last week in the Journal of American Medical Association, JAMA, and showed that it was actually now 35% net decline in OBGYNs practicing in the state of Idaho since the abortion ban went into effect. What this means for us, it means Idaho continues to lose the much-needed medical professionals that are the cornerstones of women's health care, not just during pregnancy, but across their entire lifespan. For example, I have patients suffering from postmenopausal bleeding in their 50s, in their 60s. They are waiting months to get in to see an OBGYN, to consult for a hysterectomy that they need. The reduction in this workforce further threatens healthcare access, not just for women, but for all Idahoans. Pending Medicaid cuts, looming, our ability to do our jobs now to keep our communities safe and healthy are becoming that much more difficult. Like many of my rural colleagues, I take call for days at a time, sometimes 4-day stretches. I spend much of that time worrying that the next patient that comes through the doors will face delays in care as we consult with lawyers before providing the care that they need. I get it. I understand why every single one of my colleagues, some of them good friends, people that I trained with, that I looked up to, that I referred to, have left Idaho behind. It's untenable to force physicians to divert from standard medical care and ignore their medical training and judgment to answer to a political agenda that has nothing to do with the lives and the healthcare issues that our patients face. So while this paints a very dire picture of the care crisis in Idaho at this moment in time, with all of healthcare in the balance, I do remain hopeful we can get out of this dangerous time in Idaho and in our country's history. As in the rest of America, most Idahoans do believe healthcare decisions are best left to patients, their families, in consultation with their doctor, not with politicians. As a physician who's seen the devastating impact of abortion bans on my community, my healthcare system, I'm leading this organization, the Idaho Coalition for Safe Healthcare, where we advocate, educate, collaborate with other organizations in the state for the decriminalization of standard healthcare and protection of the patient-provider relationship. We're grateful to join with our neighbors in Washington, leaders like Senator Murray, to fight on for the care every American deserves, no matter what your zip code may be. It's my honor to hand the floor back to Senator Murray. Thank you.
Thank you very much. So as you've heard, all the decisions over the last several years have really impacted women's health and women's ability to make their own healthcare choices with their own doctor because of their own circumstances, not one made by politicians. So we're raising the alarm and saying we are fighting back. We need people's help and support. Speak up. Now is not the time to be silent. With that, Naomi, we'll turn it over for any questions that any one of you would like to ask.
Kayla, do you have any questions? I have a question for, how do you pronounce your last name, Rebecca?
Gibron.
Gibron? I'm wondering, what are the on-the-ground effects you're seeing of that 55% cut in state funding?
Yeah, I mean, listen, we're trying to figure out how we are going to fill this gap and provide care to Washingtonians who need access to abortion care that, as Senator Murray mentioned, is largely uncompensated. You know, these are patients who don't have insurance, who don't qualify for Medicaid. These are very real impacts to people's lives, and I'll be honest, I don't have it figured out yet. I really don't, in terms of how we're going to fill this need for patients who need access to abortion.
And then Dr., how do you pronounce your last name?
Ereme.
Sorry. Say it one more time.
Ereme, Ray of Sunshine,
Ereme.
month of May.
I was wondering, with increased patients coming in from other states, what are wait times looking like for abortions in the Seattle area?
They're looking pretty long, especially depending on where you're seeking care, because of the influx of patients that are coming in. And depending on the acuity of care, whether they need hospital care or clinic care. And it's important to note that, yes, Washington is a safe state, but there are very few places in Seattle that actually provide abortion care. It is not every hospital. We get many referrals from many local hospitals that don't do abortion care. So it's not just from out of state, it's honestly from the city itself, from the state itself, where there's only a few places where people can actually access abortion care. And this is in a safe state. So imagine how hard it is for people to travel many distances from other states that don't provide this care. And this is truly just a travesty of personal choice.
Are there any specific clinics or hospitals where you're seeing either they're near the airport or where are the biggest impacts?
I don't think it's like based on like nearest to air. It's just based on where people find that they can get care. And a lot of times people, when they're coming in for later abortion care because they've had to, for one, find out they're pregnant, figure out something's going on, figure out where to go to get care, how to get there, how they're going to pay for it. So not only are you pushing people to have abortions later in their gestation, but you're also making them travel far distances and have huge financial barriers to getting that care.
And I can speak on how long it takes because back in 2022, I actually received abortion care here at the University of Washington, and they were looking at 2 weeks from when I had called. So, and then they weren't even sure I could get in the day that I came. They called me and told me they would let me know when they had a bed available.
And you were traveling from Idaho.
Yeah.
And that was here in Long Lake.
Yep.
I mean, the reality is the state of Washington has seen an over 30% increase in patients from out of state who are seeking abortion care. In our Planned Parenthood Health Centers, we have seen patients from as far away as Florida. And with this now Medicaid defunding and the risk of, 200 plus Planned Parenthood Health Centers across the country that could face closure, the impact on the health system across the country in blue states, with clinics not being able to stay open, will only exacerbate, right, the time that it takes for patients to access care in a safe state. And it puts strains on the entire network of patient access to preventive care, to birth control, to cancer screenings, because the system is so taxed by patients having to travel to access basic reproductive health care.
And that 30% increase, are you seeing that distributed kind of equally across Washington State? Because some people are driving from Idaho and some people are flying in from further away? Or is
That's a great question. I don't have the answer to that. I just know overall what we're seeing. I can speak to our health centers in Western Washington. We definitely are seeing a 30 to 40% increase. And every month that number continues to grow of out-of-state patients. And listen, patients are finding care as quickly as they can, wherever they can in this country. And, we've got patients who have family members here or have friends, old college roommates that they're reaching out to have a sort of safe system of friendly faces and loved ones who can help them when they're traveling to a state to access abortion.
Great. I think we'll wrap and take your group photo.
All right. Well, thank you all very much for sharing your stories. I think I was really struck, Heather, as a victim of sexual assault, Kayla, because of a healthcare instance, and you because of a circumstance beyond your control where you and your husband or your partner at the time just simply couldn't afford it. Women, for all kinds of reasons, seek health care. And in this country right now, it is becoming extremely dangerous based on where you live, based on how much money you have, and based on whether you have a friend in Seattle. That is not how our country should provide health care. Thank you.